This video will focus on cellular regulation, specifically examining prostate cancer and breast cancer. Here we see an illustration of the normal prostate compared to a cancerous prostate. Prostate cancer often has a high survival rate. The pathophysiology involves androgens promoting the growth of both normal and cancerous prostate cells. Spread or metastasis is possible, and symptoms include difficulty urinating or blood in the urine. Risk factors for prostate cancer include age, particularly over 65 years old, race, such as African American men, diet, and history of a vasectomy. Common symptoms related to prostate cancer are urinary difficulties, such as dysuria, urgency, frequency, and nocturia, as well as hesitancy and hematuria. Assessment involves a health history focused on sexual and elimination patterns, along with a physical assessment, including a digital rectal exam. Diagnostic tests include the digital rectal exam, or DRE, the prostate-specific antigen, or PSA test, cystoscopy, X-rays, and transurethral ultrasound, or US. Prevention includes medications like dutasteride and finasteride. Early detection is achieved through screening after age 50 or earlier if there is a family history of prostate cancer. Screening recommendations vary. Men over 50 years old should have an informed decision with their healthcare provider about whether to be screened with a PSA test or DRE. Surgical interventions include various types of prostatectomy, such as radical, retropubic, perineal, and suprapubic prostatectomy, as well as radiation therapy. Different surgical approaches, like retropubic and suprapubic prostatectomy, have distinct illustrations, descriptions, and nursing implications regarding incision assessment and catheter management. Post-TURP care focuses on continuous bladder irrigation. This includes monitoring the rate of infusion, proper catheter care, and meticulous intake and output recording. Complications of radical prostatectomy include erectile dysfunction, stricture, fistula, incontinence, and general surgical risk. Radiation therapy complications involve erectile dysfunction, stricture, rectal ulceration, cystitis, diarrhea, proctitis, bowel obstruction, and incontinence. Hormone treatments include surgical orchiectomy, estrogen, luteinizing hormone, and various antiandrogens. Disadvantages can involve body image issues, cardiovascular risks, slow onset, weight gain, and expense. Radiation therapy may offer a decreased risk of side effects compared to surgery for some patients and can be used for palliative care to relieve symptoms. Moving to breast cancer, these illustrations show the internal anatomy of the breast and the appearance of the skin in advanced cases, demonstrating the structures that can be affected by the disease. Risk factors for breast cancer include a history of breast cancer, family history, early menarche or late menopause, and lengthy exposure to cyclic estrogen. Signs and symptoms can include a lump in the breast, nipple discharge, thickening, or dimpling. Recommended screenings for breast cancer include breast self-awareness for all women and mammography. Mammography should begin at age 40 if desired, with annual screenings from ages 45 to 54. Surgical interventions for breast cancer range from biopsies, such as incisional, excisional, and aspiration, to various types of mastectomy, including simple, modified radical, and lumpectomy. Adjuvant therapies for breast cancer often follow surgery and include radiation, chemotherapy, hormonal therapy, and monoclonal antibody therapy, each targeting cancer cells through different mechanisms. Nursing interventions for a mastectomy patient include monitoring vital signs, checking for symptoms of shock or hemorrhage, and monitoring drains, postoperative dressings, and respiratory effort. Further nursing interventions involve assessing and treating pain, positioning the patient in a 45-degree Fowler's position for drainage, encouraging deep breathing and coughing, and providing meticulous wound care. After breast surgery, preventing infection is crucial. Patients should wear gloves when cleaning or gardening, avoid injections or blood draws in the involved arm, use cuticle remover, and shave underarms with an electric razor. To prevent constricting circulation, patients should avoid taking blood pressure on the involved arm, wear loose clothing, and wear watches or jewelry on the uninvolved arm. Patients should also avoid lifting heavy objects and carry purses on the uninvolved arm or shoulder to prevent drag or pull on the affected side. Discharge concerns after a mastectomy include explaining the follow-up routine, stressing the importance of breast self-examination and annual mammography, and reporting concerning symptoms to the healthcare provider. It is also important to stress the use of a well-fitting prosthesis and recognize that the patient's partner or family may need emotional support and counseling to deal with the diagnosis and surgery. Now shifting to lung cancer, Approximately 87% of cases are linked to smoking. It is an insidious process with few early symptoms. Later symptoms include weight loss, fatigue, hemoptysis, fever, and chills. Diagnostic exams for lung cancer include CT scans, PET scans, MRIs, sputum specimens, and mediastinoscopy to identify the tumor, metastasis, and determine the cellular type. Screening recommendations for lung cancer include annual low-dose computed tomography, or LDCT, for adults aged 50 to 80 years old with a history of heavy smoking. Medical management for lung cancer may involve surgery, radiation, and chemotherapy. The chosen treatment depends on the cancer type and stage. Treatment is based on the type of cancer and its stage. Surgical options, if the malignancy is localized, include wedge resection, segmental resection, lobectomy, and pneumonectomy. Radiation and chemotherapy may also be used. Nursing interventions include emotional support and post-surgical care to facilitate recovery. Encourage incentive spirometry, leg and foot exercises, and administer supplemental oxygen while monitoring saturation levels.